state of state. We had seen last time how Freud had pointed out that the state in which the person was when the traumatic event occurred, that state had quite something to contribute in determination whether or not the said event will lead to a trauma or otherwise. So Freud talked about the stimulus and the strength of the stimulus, 1. 2, the state in which the person was. And 3, the strength of personality of the person, the healthy part of the person. These 3 are very important in determining whether something will become traumatic or not become traumatic. So the strength of the stimulus, the response to the stimulus of the person, how strong the response is based upon how healthy and sick part of the persons play out in that state, and third, in that situation, and third, the psychological state in general into which the person is. And this brings us to the point of going in details into the word state. We will see in a concise way what this state is all about in the context of Freud's discussion. If you want a more general discussion, I have a video on this titled State of Change on my channel, YouTube channel. You can see it there, but in a concise way focused on what Freud has said in his preliminary communication, Studies of Hysteria. On that limited point, in a concise way, let us go deeper today into this idea of a psychological state. What is a state? At any given point in time, different elements are active or deactive, or let me say non-active in the system, and the active elements in the way they are active constitute therefore a state in the personality, or rather constitute a state. For example, at any given point, if anger is active, pain is active, that may create one particular state full of anger and pain. In another situation, if happiness and enthusiasm are active and the negative emotions are completely deactivated, they create a different state of the person. So state is a condition, a very dynamic thing, but a condition at any given point in time, that at any given moment, what are the elements active and deactivated in the personality so as to constitute a state, a temporal state in the person, or rather a temporal state constituting the person at that particular moment. This is how we can define a state. Now, if we look at use of state in psychotherapy, we can divide on this point all psychotherapy approaches into two categories. Those psychotherapy approaches which create a state and then deploy their tools in the context of the state already created. These therapies, I would say, are state-based therapies or state-creating therapies. Another set of therapies are those which don't so much go into creation of the state and straight away use their approach or their tools for healing. These, I would say, are regular therapy approaches which don't go into the creation of the state. If we look at popular therapies, the state creating therapies are psychoanalysis, ISTDP, EDT, experiential dynamic therapy, and psychodrama. All these four, they create states which they believe are more conducive to healing, and they create these states through various means. We'll go into it in a moment. If we look at regular therapies which don't create states, we can look at cognitive therapy, cognitive behavioral therapy, existential humanistic therapy. They don't create states. They directly use their approaches and tools for healing in the session. Let us look at how the state creating therapies create a state. Fundamental belief here is that all states are not equally conducive to healing. Some states are more conducive to healing than others, and therefore we have to create such states so that healing can be accelerated. Psychoanalysis creates a healing state or a state more conducive for healing by use of what is called the psychoanalytic frame, where the person comes and lies down on the couch, and in that position itself resistance reduces. The analyst is behind the person, out of the line of sight. The patient reveals himself completely, but the analyst is completely anonymous. They meet only during the therapy hours and have no communication outside of the therapy hours. The analyst gives interpretations which more often than not are softly hurting to the person, whereas the person cannot give interpretations to the therapist. The power differential is completely in favor of the therapist. In the regressed state on the couch, over a period of time, as the transferences get created, a state is created where the person regresses into a state of reverie, opens up himself, at the same time feels the therapist to be far more powerful and positive than he actually is. And the person feels himself very safe to reveal out all that he has to say, right or wrong, real or imaginary, and without any shame, embarrassment or fear can articulate whatever comes to his mind. And this creates a state which is conducive for healing in psychoanalysis. ISTDP creates a state in a different way. ISTDP recognized the significance of creating a state when the founder Dawan Lu saw that when we are in a crisis, something happens to us, and in the middle of the crisis, we are able to bring about fundamental changes in ourselves, mostly related to those things in us which have led to the crisis in the first place. But long-term restructuring of our unconscious mind, of our deeply held beliefs, of strong elements of our personality is possible in the state of that constructive crisis. The question then for ISTDP was how to artificially create this constructive healing crisis, this state where healing can be done rapidly, deeply, and accelerated in its speed. So ISTDP creates a state with its own method. The method is this. ISTDP uses face-to-face form of therapy where both are, the therapist and the patient are sitting face-to-face on a chair facing each other. Once you make the patient sit, and the patient has to be seated for an hour or 2 hours or 3 hours based on the duration of the session, behavior part is completely out. What remains then of the triad of thought, affect, and behavior, the three principal players in the mind. Once you make the patient sit on the chair, behavior is out. All that remains is thought and affect. So thought is treated like a defense, and we ask the person to put aside thoughts, and thought is mildly criticized, at times even heavily criticized. Once you put thought aside, all that remains is affect and the defenses which are guarding the affect. And the anxiety which is coming out as the affect starts being noticed, being focused upon. So ISTDP creates this state of rapid healing by first making the person sit, so the behavior element is out, mildly criticizing or disapproving of thoughts, so thoughts are out, and then focusing on affect. And as we focus on affect, we have to deal with anxiety and defenses. So this is how, by dealing rightly with anxiety and defenses, ISTDP tries to create an optimum state of change, which it calls the state of anxiety being in the striated muscles. That is the state ISTDP creates. Experiential dynamic therapy, depending upon, there are various forms of it, depending upon which form we are talking about, some of them also create a state conducive to healing. One element I forgot here, the most explicit and dramatic use of the element of state is the approach of hypnotherapy. So hypnotherapy creates the state of trance which it believes is most conducive to undoing resistances and inducing healing. So they induce the state of trance by asking the person to lie down on a couch or on a slanted resting chair, and then take the person into very deep relaxation, through that relaxation into a state of trance, and in that state of trance be in communication with the person. So the person is not completely asleep but in a state of deep relaxation and trance, but is communicating with you and also thinking and visualizing at a very serene level, in a serene way, which does not disturb the state of trance and relaxation. That's how hypnotherapy creates the state of healing. Psychodrama creates the state in a different way. Psychodrama creates a state by really enacting the whole situation, by concretizing the inner thing outside. So if you have a problem with the father, somebody can actually play the role of the father and you can be on the stage, and some incident, some event which was very traumatic to you can actually be reenacted in a very concrete external way. And that is how, by recreating the original traumatic situation and by the person participating in it, the person can go into the situation again in a very concrete experiential way, with the adult mind and the healing part of himself fully awake and active, and try to re-enter that state and induce healthy changes. So these are some of the examples of state creating therapies which create states in different ways. So there is no one way, there is no one state which is supposed to be which is accepted as the best state for healing by all state creating therapies, and there is no one method of creating a state. So within the state creating therapies, there are differences of which state is the best for healing and how to create that state. In regular therapies, we don't have to worry about creating the state. We just have regular sessions. In state creating therapies, we first create the state, and once the state is created, then we use the tools and techniques in the context of that state which has been established. These tools and techniques may be statements, they may be certain ways of taking person to the center of something, they may be certain visualization exercises, whatever tools we use, whatever techniques we use. But in state creating therapies, we use them in the context of a state after having established that state. Why do we create a state? And what are the constituents of a state? In a generic way, in an elemental way. All know by direct experience that change related to deep-seated problems is not easy. However, we also know that when we are in a crisis, it is far easier to change than to change in a steady state. In a steady state, we just learn to live with our chronic problems. We normalize them. They become parts of our lives, and many of them even become egosyntonic. However, when we have to pay a very heavy price for our problems and a crisis is created, in the middle of the crisis, often we repent why we did not work upon and change the problem when we had time. And had we done it, we would not have had been in the situation that we are. We resolve then to change, and in many situations, during the state of crisis, we are able to bring about a deep-seated lasting change, a deep-seated lasting restructuring of very strong elements in our unconscious mind and personality. And this creates for us a possibility how to create a constructive crisis. Crisis did not always be constructive. There can be a crisis which is so overwhelming that no constructive change is possible, quite possible. So every crisis is not a healing crisis, but there are some situations of crisis which we can call as constructive crisis, which are very conducive for healing. So the question is, how do we create that constructive state, that state of constructive crisis on demand? Is it really possible? And if yes, what elements we have to focus upon? If we deconstruct what we are saying, what we are phrasing as state of constructive crisis, how do we create such a state? What are the elements which determine the constitution of such a state? Some of the elementals involved in such a state creation are listed out on the slide. The first is awareness. Second, concentration. Third, emotional activation. Fourth, danger. Fifth, realistic assessment or insight. Sixth, a deep catharsis. Seventh, a deep cognitive restructuring. If we look at these points, the first 5 points actually are the points of state creation. Deep catharsis and deep cognitive restructuring actually are the results of it. I should have put them separately. They are not a part of the state creation. They are the results of a successful state creation and using that state for healing. There is a mistake on the slide. The elements of state creation are awareness, concentration, emotional activation, danger, and realistic assessment. If these 5 elements are present, we can successfully create a state. A state of constructive crisis which can accelerate, deepen, and provide us lasting restructuring of deeper parts of our personality. First, awareness. If you are in a state of heightened awareness, just by awareness about something, we can heal that something in many cases. In some cases, only awareness is enough to heal. In some cases, it is not enough to heal. But awareness is a very important element, and in many cases, just simple practice of awareness can lead to healing. And awareness itself is enough for creating a state of accelerated healing compared to a normal state. Concentration is second important element. If you are aware and then you develop concentration, awareness and concentration put together create a very formidable tool, a very formidable entity inside, a very formidable combination to heal what we are observing inside is creating trouble for us. So any trouble creating entity inside that we observe and we concentrate upon, once we have awareness and concentration focused upon any trouble creating entity, it's easier to heal that trouble creating entity. But here concentration has to be after awareness creation. If we say only concentration without awareness, that will become a very intellectual concentration which we have all the time. It is good for intellectual purposes, but not good for transformative purposes with which we are concerned when we talk about healing. Third is emotional activation. If we have awareness, concentration, and emotional activation, then we are in a state which is even more conducive to healing than just having awareness and concentration. But if we take only emotional activation and we don't have awareness and concentration, we just go through an emotional experience, we don't go through a transformative experience. A slight amount of danger, a slight amount of risk, a slight amount of anxiety also helps in creating the state which is even more conducive to change and healing. If the danger is very high, then the awareness, concentration, and emotional activation can't be used for healing, and the anxiety then becomes crippling or damaging. It becomes what I call destructive affect mobilization. But if the danger is within reasonable limits at the mild level, what we would say in ISTDP, in the striated region, then such a danger acts as a catalyst, mild danger acts as a catalyst and even multiplies further the efficacy of awareness, concentration, and emotional activation. And last is a realistic assessment and realistic insight, which can be transformative. So realistic assessment and a transformative insight. And often realistic assessment in that state leads to a transformative insight. And these elements, they constitute a state of constructive crisis where deep, lasting healing changes, restructuring can happen in an accelerated way. And they lead to a deep catharsis and a deep cognitive restructuring. How to create a state using the four different therapy approaches, different spiritual approaches, different holistic healing approaches. They all use these elements in different ways to create a state of constructive crisis for quick change and quick healing. How do we use these states, and how do we understand the working of these states? Why do these states work? Why do our tools work better in these states? It's a large area to explore, a deeper area to explore. We'll get into complications of model of the mind and pathogenesis. We'll also get, if we go deep enough, into the complexities of our view of the human integer and our view of reality. Let us not go into those philosophical depths today, and let us take a concise, practical look at what is working when we talk about a state-led healing. First, we are recreating the traumatic situation in a safer version. So when we recreate the traumatic situation in a safer version, in a bearable version, when we are there to support the person, it's a safe space. The person is empowered to really revisit that traumatic situation and allow full effects to come up. Slowly, in packets maybe, but still ultimately in the long run, the entire effect comes out. One way why it works. Second, we are concretizing the elusive psychological situation. For many, it is not easy to very clearly and concretely understand the inner psychological play at the circus which is going on and the inner players who are at work. So they need something concretized outside. So they won't be able to make, this group won't be able to make out clearly the play of the ego, the superego and the id. But if you create a psychodrama where one person is the id, one person is the superego and one person is the ego, such an externalized, concretized form can often lead to deeper understanding and transformative insights, at times even to catharsis. So this is second element, how we use the states and why the states work. Third is visualizing the problem and the movement to the solution. Here we are creating the state, recreating the state, and the tool that we use is visualization. In the first instance, the tool, the approach that we are using is creating a safe space. In the second version, the approach we are using is concretizing the esoteric, elusive inner situation outside. In the third point, we are using the tool of visualization. And we are helping the person to move to a positive solution by support, encouragement, affirmation. At times also by acknowledgement and admiration. At times also by attention and affection. Now, how do we do it? When we revisit a certain situation, a traumatic situation, we ask the person to go into every detail that he can recollect of that traumatic situation. For example, if a person has been beaten up by a parent 15 years back, we ask him to recollect that situation and think about which room he was, what was the color on the walls, how were the windows looking, what was the color of the windows, how was the window grill, what was the color, what other elements were there in the room. And as the person recollects completely, he moves psychologically into that situation completely, and in that situation change becomes easier. We can create a trance to remove resistance, which we saw. That relaxation can help us to overcome resistance. We can also make use of homeopathic medications at times, because homeopathic medications at times also create states. Unfortunate part is they are not in our control. So homeopathic medications often create states in which the person is able to use his own resources of cognition and insight very easily and bring about a change. So the conscious work is 10%, the homeopathic medication unconscious work is 90%. But the state gets created automatically and you are almost heralded into using your abilities to bring about a lasting change. In shamanic techniques, certain substances are ingested to create states. And in that state, then the tools given by the shaman or the tools which are used by the tribe, they are used to bring about change. In Rig Veda, we have the mention of soma, which is supposed to be a substance which is to be ingested during the Vedic practice, Vedic spiritual practice, and that creates both first the state and then the process of change. So we also have state creation processes by the stage creation in the community in the shamanic practices, and by rituals used in the Vedic practice along with ingestion of certain substances called the soma. So these are the various ways in which we create the states, we use the states get created, the states get used, the states which can be created by ingesting certain substances, which can be created by ingesting substances in the context of a social situation or a spiritual setting. If we go further into the idea of creating the state, spirituality has its own ways of creating states. This may involve guided visualization. This may involve music, songs and poetry. This may involve listening to stories. This may involve certain yagnas or certain spiritual practices, mystical practices, or just a deeper interaction with the guru or the guide or a person who is along with you on the path. Second, we have meditative techniques which create states. For example, there is a white light guided meditation where you relax the whole body from the leg to the head slowly by using white light, visualizing white light, relaxing the whole body and mind. And once relaxed, you use that state for self-affirmation, for self-exploration, for cognitive thinking and so on. Idol therapy is a full package of creating a state by first creating an idol, being with the idol, worship of the idol, doing certain activities on one's body and on one's mind, and through various things over a period of time create a state which endures for a long time, and then in the context of that state use the tools of various practices. Tantra has its own way of creating the state, and the left hand part of the Tantra actually creates that state of change by taking somebody to a smashan or a crematorium. The moment you go there, automatically you are in the striated state or in the CPD state, cognitive perceptual disturbance state, because it's very difficult not to have anxiety in the crematorium. So if guided properly, you are able to create a state conducive to change and not a crippling state. Collective cultural and religious practices also create states. We can see that in the case of confession box. We can see that in atonement-based religious practices. We can see that in religious and cultural practices based on forgiveness. And crystals and idols are also used to create a state. Crystals are used to clean up the aura. Same with idols, but idols are far more powerful and many other functions they have apart from a crystal. But both of them can be used to create a state, and both of them can be used once the state is created to be used as tools to be deployed in the context of the state. So we can use two crystals, one to create state and second to be used as a tool in the context of the state, or we can use the same crystal for state creation and as a tool to be used in the context of the state. If there are any questions, let me know.